from Nutrition Action Zimbabwe. I'm just going to present on a few breastfeeding difficulties that most mothers might face when they are breastfeeding. So we have quite a number of difficulties, but I'm just going to focus on mainly on 4 that I have here. So I'm going to show you a couple of pictures so that you can visualize some of the conditions that I will be showing you. So I have the first one here with me. This one. As you can see, the mother's breasts are swollen and the nipples are flattened, as you can see. This makes it difficult for the baby to suck on the breast because the mother has got what? The breasts are kind of like swollen. What causes this condition is when you do not breastfeed your baby like oftenly as much as you should, there is overproduction of milk which will stay for a longer time in the breasts, resulting in them being swollen. So it will be very painful for you to breastfeed the baby, and henceforth it will come up as a difficulty or a challenge. Even when the nipples are flattened, it becomes difficult for the baby to actually attach to the nipples or to that black part that we call the areola, so that they can actually breastfeed properly. So this is one condition that most mothers face, especially those who do not really like breastfeeding or who are really budgeting on their milk. They don't breastfeed much. So we recommend you that you breastfeed on demand and you also breastfeed more, because the more you breastfeed the baby, the more milk will come out and your breast will have rest, if I can say that. So this is one condition that can actually affect mothers out there, like their breasts are swollen. So we call it breast engorgement. That's one condition that once the breasts are swollen and you're not doing anything about it, it becomes a habit for you. They might get inflamed, or they might show some redness here, as the next picture is showing. This condition is called mastitis. It can be a bacterial infection, it can be an infection, or in other circumstances, it can be just milk that could have stayed in the breast for a long time, resulting in the breast getting swollen, getting red on some part, and also having an abscess. That is saying the milk will actually stay in one area and will just come out with pus or something like that. So at this condition, we recommend that the mother do not stop breastfeeding, but however, they should express their milk so that they can continue breastfeeding their babies. But if it's a severe condition, you can go to the clinic, you can get antibiotics if it was caused by an infection, so that you can get treated for this condition, so that the baby can continue breastfeeding. We do not stop breastfeeding, but however, we can seek for medical advice, or we can just express and continue breastfeeding when this condition has resulted. So these are some of the conditions or difficulties that a mother or a woman can face when they are breastfed. It's common are cracked nipples. I've seen most ladies have encountered this condition, cracked nipples. It is usually more persistent in new pregnancies, like those mothers that have had their firstborns. They usually have this condition. We do not stop breastfeeding once again, but however, you are advised to rub just a few drops of milk on the cracked part, so that you can allow for healing of the cracks. As we know, breast milk has got some healing properties that are in them that can actually help to repair. But if you are HIV positive and there are sores that are as a result of these cracks, you can visit your nearest clinic so that you can get help. But we encourage you to continue breastfeeding, or you can treat the milk so that the baby cannot get the HIV. Then we have got sores. Some of the conditions are as a result of other conditions. Sores, you can just get sores because of the cracks that you might have that previous time, and you do not do anything about the cracks. They can result in sores. So we recommend that whenever you see a crack, you should do something about it earlier, so that you can prevent the development of sores. So this makes it difficult for mothers to breastfeed, because the breast would have sores and it would be very difficult and very painful for the mother to breastfeed. So those are some of the conditions that we have. We have engorgement, like I've said before. We have mastitis, that is the inflammation that is resulting in the abscess. Then we have cracked nipples, these ones. And then we have sores that might result. So all these conditions, they are quite painful, but we encourage mothers to continue breastfeeding. And if the conditions are getting worse, we encourage you to visit your nearest clinic for further medical assistance. Thank you.